Okay, for the last of our speakers, please welcome Diarmid Campbell-Lendrum from the World Health Organization, the Global Health King of Climate, I think we'll call you. He's going to sharpen our focus on health. Diarmid.
Thanks so much, and thanks for the new title. That's going to be hard to live up to. I recognise we're short on time, I think, in every sense of the word, so I'm going to rattle through this quite quickly and try, hopefully, keep some time for questions as well. But it's an absolute pleasure to be here. It looks like a fantastic meeting. Thanks to the organisers, thanks to the previous presenters, and to the Wellcome Trust for supporting this. I usually use this slide to introduce the presentation because it reminds me of one of the central messages, I think, around the challenge of climate change and health. It's a slide, as you can expect, taken during the COVID pandemic, I think on the west coast of North America, where we were putting out these messages about what to do about COVID. And there was a massive amount of effort, transformative effort, to respond to the pandemic, and not doing a great job of managing what is driving those wildfires, the drivers of the increasing risk that will, in fact, is already starting to and will bring greater devastation, almost certainly, than the COVID pandemic. I think one of the messages that I wanted to get across is that most people around the world now get this. We know, and you can look at opinion polling from around the world, climate change is already affecting us very negatively. It's going to get worse. Something should be done about it. Even the global leaders, if you like, the kinds of people who turn up to Davos, also recognize this. So if you look at what they're concerned about in the short term, it's risk of global conflict, misinformation, so on. If you look at what they think are the big risks out 5 or 10 years in the future, those things are overtaken by the stuff in green, which is effectively climate change, environmental destruction, and so on. So to quote Mark Twain, everybody talks about the weather, nobody does anything about it. That's the kind of situation that we have. The recognition, I would say, in general, is there about the problem. What is lacking is the actual actions at the scale and pace that we need in order to address that. And that goes for health as it does for the other aspects of climate change. If I can get this to move. Okay, so we know that in terms of the global picture, and you've heard it very eloquently and I think convincingly from Marina based on the data that they've put together. The other message that is very different from when I started working on this issue about 25 years ago is that it is here and now, and the evidence and the scientists are also very clear about this. When I started on this issue, every time there was an extreme weather event, people would ask scientists, well, is it climate change? They'd hum and ha and say, well, you can't attribute any one specific event to climate change. That's all gone now. They are now very clear that when there is an extreme heat event in the UK, climate change has played an influence in that. When there is a flood or a drought, yes, climate change played an influence. And it's partly the improvement in the evidence, the attribution methods to have the certainty about saying that, but it's also the recognition that we can't hum and ha about this problem anymore. We need to be absolutely clear in our communications about the risks that we face. That's true in London, it's true around the world, and in many diverse ways. So I don't need to spend time on this, you've heard about it with the data, but of course we're not just talking about heat, we're talking about floods, we're talking about droughts, we're talking about storms, we're talking about improved conditions for transmission of infectious disease, and we're talking about eroding the fundamental environmental and social determinants of health, including, for example, access to food and water. So that is the scale of the challenge that we're facing. And again, when I started working on this issue, most of what we were talking about was future projections. That's not the case anymore either. This is one of the summary slides from the last report of the IPCC. It basically says, wherever you look in the world, across almost any dimension of human well-being, we're already seeing negative impacts. There is no real good news on this slide. So even at the modest rates of warming that we've experienced, we're already seeing these things start to play out. We also find that the more we look, the more we find to worry about. Literally in this case, I was talking to a colleague yesterday evening. I remember the first conversation I had about mental health and climate change was at a meeting with young climate activists in 2019. I haven't probably been at a conference or had a meeting on climate change and health since where people haven't talked about mental health and climate change. It's already showing up in the concerns of young people about their future, as well as, of course, showing up in the acute impacts of extreme weather events and so on people's mental health. But it just, further substantiates and builds up the evidence and the negative story that we know about the way climate change is affecting us. So I was actually asked to talk about, okay, what is the global health response to this? I'm quite proud to say on behalf of WHO that we have elevated this to the top of the global public health agenda. So in the next 5-year program of work for WHO, but it's actually on behalf of all of our member states, 194 for the moment, that we only say we will do 6 things. The first of those 6 things is climate change and health, recognizing that it will affect everything else that we do. And when you consider that we deal with everything from health systems to emergencies, to infectious disease, non-communicable diseases and so on, it's quite a strong statement to say we will put climate change as the first of only 6 things. You can read the sort of UN language on there, but it basically says, and there was, I have to say, there was quite a lot of effort to make sure we could get the permission to cover all of this agenda. But we need to do adaptation and resilience and on health, as you've just heard from the last presenter. But we also need to play our part as a health community in mitigation. And that's both mitigation within the health sector, because health, including the healthcare supply chain, is getting on for 5% of global carbon emissions, 10% of the global economy, one of the biggest employers in the world. So we have a role to play there. But it's also, we had to battle for it to be able to talk about the role that health has in having an influence in other sectors to do the right things in energy systems, transport, food systems, and so on, in order to get the massive health gains that we will get if we're able to transition to a greener and more sustainable economy. Just very briefly, what this means, we think, within health systems. I try and sum up what our goal is within health systems on a single slide. The vertical axis is an index of universal health coverage, so basically just overall how good your health system is, crudely. Every dot on there is a country. We're trying, as it's been WHO's mission for decades, drive countries up. We want everybody to have a much better health system overall. Along the horizontal axis is carbon emissions from healthcare, including the supply chain. And we have to think about keeping countries on the left-hand side, so not emitting more carbon than they need to in order to provide really good health services. And then also we're starting to get measures of what health systems around the world are doing in order to make them more resilient. The kinds of, all of those boxes basically that you saw in the last presentation go into our rating of green, orange or red. In terms of how resilient health systems are. So we basically want everybody top left green, if I'm going to be crude about it. I won't dwell on this, but of course, as WHO is a technical agency, we give technical guidance to countries. And for about 10 years now, we've been supporting countries to try and ensure that their health systems are climate resilient. Again, all of the things that you've just heard described in the last presentation. And we try and do this not by saying you need to invent a new health system with completely new functions. We say you've got core building blocks of your health system, which are common more or less around the world. You need to build in climate resilience to each of those functions, whether it's your financing function, your data function, service delivery, and so on. And you also need to make them green. And then we support countries and track them to see how far they're getting, how well they're doing in doing that. So that's basically what we're trying to do, what we're supporting being done within health systems. But this is also the other side of the story, the mitigation side of the story, again, is where we think health has a really important part to play. So this slide basically sums up, I would say, more or less how climate change people see the problem, which is greenhouse gas emissions come from different parts of the economy, contribute to overall greenhouse gas emissions which are driving climate change, there is a really important health dimension to all of this. Any decision that you make about energy is actually a health decision. Any decision you make about agriculture and food policy is a health decision because it affects some of the largest health burdens that we have. And if we don't get those things right, then not only do the emissions grow, then, but potentially the health issues associated with that grow as well. But if we do get them right, we can save an awful lot of those lives, and we can start saving them now. And if we don't, that's basically what happens. So just to follow up on that just a little bit, you've already heard, I think, a reference to a version of this figure. It's actually about almost everybody in the world breathes air which has air pollution in it, which exceeds our stringent air quality guidelines. That's obviously really bad news. The image there, if you're a medical student, you may have you've come across this as an illustration of a smoker's lung versus a non-smoker's lung. In fact, that's not a smoker's lung, that's somebody who lived in Delhi, breathing the levels of ambient air pollution that you experience in some of these environments around the world. And that risk factor is as big as any risk factor that we have in the world. Air pollution kills about one person every 5 seconds. And as you've heard, a massive amount of the causes of air pollution and all of those deaths are the same things which are driving the climate crisis. So we have a massive opportunity to save a lot of lives by, for example, cleaning up energy systems. This slide basically, again, is the IPCC's conclusion on this. It basically describes, and again, this is one of the slides from the last report of the IPCC. This is the final report, the part 3 effectively on mitigation solutions. It basically says we have solutions across different parts of the economy to fix the climate crisis. Everything on that bar chart, anything in blue actually saves you money. Anything in yellow or red starts to cost money. But it shows, first off, that we can actually get quite a long way on the climate crisis while actually saving money. If you value the health benefits that would come from many of these transitions, a lot more of this graph turns blue. You would actually get the value to human society, which, I'll come to this in just a second, is actually larger than the cost of mitigation. The health gains from fixing the climate crisis actually pay for the costs of fixing the climate crisis. So at a macro level, there is no reason why we shouldn't already be doing this. This is just illustrating in some of the more important ones for health in different parts of the economy: clean energy, sustainable and healthy food systems, sustainable and healthy transport systems, for example. And again, as WHO, we're supporting this, we're tracking it. So we have been largely behind the drive to ensure that every nationally determined contribution that a country makes to the Paris Agreement, to the UNFCCC, we think health should be in there, both on the adaptation side, but also on the mitigation side, because the health benefits of climate change mitigation are so big if you do them right. And we are seeing progress on this. We're seeing more and more countries recognize those health gains, quantify them, and value them, and we think that should hopefully be an important driver of the speed of the response. Ultimately, this should not be a difficult choice about whether we're going to do this thing or not. You've already heard this quote from Professor Tipton, but I think it's worth dwelling on for a minute again. This is a bunch of very sober scientists from the IPCC coming to this conclusion on the left-hand side. If I was to put this into layman's terms, it's basically climate change will kill your children or your grandchildren or your great-grandchildren. The uncertainty is around which generation, basically, unless we get on top of this issue through mitigation and adaptation. But then on the right-hand side, it's also making clear that the health gains just from improved air quality would actually pay for the cost of doing this. So why are we subsidizing the fossil fuel industry to a value in financial terms, or the largest part of this is in damaged health terms, to a value of, as Marina has said, somewhere in the region of $1 trillion a year. That's somewhere in the region of $3,000 per household per year around the world, on top of our energy bills. We're actually basically subsidizing the cause of the climate crisis, mainly in our lungs as much as in our checkbook. So that makes no sense. The final couple of messages I wanted to get across, particularly to this audience, is the importance of the health argument, but also the importance of the trusted voice of health professionals. I like to show this slide. There's usually quite a lot of doctors in the audience. They usually quite enjoy seeing themselves at the top of the list. I won't point to what's at the bottom, but I'll just point to what's at the top. Doctors, don't get too much ahead of yourself. There's a couple more on there. Engineers just beat you, and this is the one I enjoy the most. Nurses beat everybody. They're on our team as well. We should have more nurses talking about climate change and health, I think. But the voice of the health profession, the health argument, I think is potentially hugely important. And we see this as well. I would say we see the smarter politicians also championing the health argument and championing health voices. I have the privilege of dual nationality. I have two mayors of capital cities, Sadiq Khan and Hidalgo. Both of them have been very strong, I would say, comparatively, on health and air quality, and also putting health voices front and centre. So you have Sadiq Khan launching the ULEZ strategy with our WHO Breathe Life champion, also doctors from hospitals just across the road, paediatricians, talking about the benefits to the health of their patients of doing the things that we need to do. So we think that's progressive. We think that we should see more of that. So this is the final slide, because I think Marina ended on, we need political will. That we sometimes, as scientists, we sometimes take that as the end of the presentation. So, we've presented you the evidence, we know it makes sense, and, what can you do? There's no political will. I think that actually has to be the starting point. We actually have to think about how you generate, drive, and support that political will. I do think it is partly a question about values, about what we're trying to champion. It depends if this is what you aim for in life, basic health inequity, or income inequity. But if you think this is the ultimate goal of human striving, you're wrong. Even in engineering terms, that's actually the ultimate goal in engineering. But in terms of what we're actually aiming for, I think it's more something like this. It's healthy populations in equilibrium with a healthy planet. So thank you very much for your attention.
Thank you, Diarmid. Gosh, that picture of a lung of someone living in the polluted air of Delhi, I think will stay with a lot of us. We're technically out of time. I'm going to quickly go to one of the questions that's been put on the app. So very quick response, please. What is the WHO's vision for clean air when there is no safe threshold for air pollution and zero air pollution is an impossible scenario?
Well, I think the most important thing for us as WHO, and I think for most people in this room, is not a technical guideline value. It's not whether you can get everybody below our line on the graph. It's how many lives you can save. And so I would say that we're really much more in the business of trying to shift the bell curve of the population more towards the cleaner end of the spectrum. So it's true that almost the only people breathing really clean air in the world are people living in rural Canada or Norway. That is effectively, that's unattainable, but you can get an awful lot of people to a much lower level of exposure and save millions of lives. And we do see it happening around the world. China, for example, has made great progress in reducing their air pollution. And the progress that they've made on levelling off carbon emissions, I would say, has been driven much more by health and the air pollution imperative than it has about any aspirations for global climate.
Thank you. Okay, you've got time to grab something to eat, drink in the Westminster room. Find that person you've always wanted to collaborate with, and then get to your next session at 10:45. We'll see you here later.